Now I invite Dr. Suresh Kumar Pandey. He will be speaking on evaluating simultaneous bilateral cataract surgery and IOL implantation in infants, a 10 years review.
Very good morning, respected chairpersons and members on dais. I'm going to talk about our study evaluating the bilateral cataract surgery and IOL implantation in infants, a 10 years review. As we all know that the childhood blindness remains one of the most common cause which need to be addressed very urgently. Globally, 2 million children are blind, and out of those 2 lakhs are because of pediatric cataract. And pediatric cataract remains one of the most important preventable cause of blindness in India and globally. And in India, many times most of the children are delayed to come to the doctor for treatment because of many reasons. And if we talk about the visually significant cataract, in our study, more than 3 millimeter central lenticular opacity, which was considered visually significant, was taken for surgery. And IOL implantation in infants remains debatable. We did the thorough evaluation and systemic evaluation, pediatrician consultation, anesthetic consultation, and then we took 30 cases which were reviewed in a retrospective study who underwent cataract surgery and lens implantation, bilateral infantile cataract surgery and lens implantation. And as very nicely mentioned in the previous talk, that this is very important and ethical and sensitive review, and the surgeon should be very careful in doing both cases simultaneously because of high risk of endophthalmitis. We used all the precautions, separate trolley, surgical instruments were used, each eye undergoing separate cleaning and draping, and the lens implantation together with primary posterior capsulorhexis, primary posterior capsulectomy and antivitrectomy was done to prevent the visual axis opacification. IOL power calculation remains a challenge in such cases, so we used the undercorrection to adjust the power, and 20% undercorrection was done. And post-op follow-up was included refraction, IOP measurement, and amblyopia therapy. And this is the surgical video showing the bilateral cataract surgery and lens implantation in infant, 5-month-old infant. And in 4 cases, we used Zepto precision nanopulse technology to achieve the anterior capsular axis, and this instrument is very good. However, we should be careful in using such instrument in infants because of the shallow anterior chamber. In this particular case, we used dispersive OVD viscoat, and this is lens implantation done, and this was followed by the primary posterior capsulectomy and antivitrectomy with injection of intracameral triamcinolone acetonide to prevent inflammation, and intracameral moxifloxacin to prevent the inflammation. All sutures, all incisions were sutured carefully. Every case underwent the post-op evaluation and examination under anesthesia. So in all surgery proceeded without any significant intra or post-op complications, including endophthalmitis. The visual acuity improved in all cases. In such cases, some cases, amblyopia remains one of the most challenging aspects. Amblyopia therapy, managed with amblyopia therapy. And if you talk about the age, our age group was from 18 months, and the simultaneous bilateral cataract surgery in infants improved the visual acuity, and there was myopic shift was noticed, and we noticed the visual opacification in 6 eyes, which was managed with the posterior capsulectomy. In 4 eyes, we noticed the post-op spike, which was managed with the anti-glaucoma medications. So simultaneous bilateral infantile cataract surgery is debatable now. There are some advantages are there, like you can get the cost reduction, and you can address the case at the same time. But however, it should be done very carefully because we are living in the era of litigation, and any case which can any complication can lead us into trouble. So this is, there are some reports published showing the simultaneous bilateral cataract surgery in infants, and in our series we were very selective. We excluded all the microphthalmos cases, and that's why the results were good. Thank you so much for your kind attention.
Thank you, Dr. Suresh. Very nice presentation, and you are a very confident surgeon. So I think for average surgeon, bilateral surgery would be a bit difficult prospect. What was the age group? You were saying infants, and these were
Till 18 months.
till 18 months. And
yes.
how much was the follow-up?
Follow-up was, sir, follow-up range from for maximum follow was 10 years, and it was 1 year to 10 years.
1 year to 10 years.
Yes, sir.
And some of these cases could be asymmetrical. So
Yes,
maybe they have had more cataract in one eye, and
Yeah,
so the amblyopia will be more in the eye which is having more cataract.
Yes.
So that, I think, aspect has to be, maybe if you operate one eye and other eye later,
that
some
will be better.
amblyopia therapy can be done because the vision has improved in
Yes,
that
sir.
eye. So that those things are
In most of cases, sir, cataract were like, total cataract.
symmetrical total
Yes, sir,
cataract.
yes. Thank you, sir.
And thank you.